All right, this is chapter 5, medical terminology. This is the fun stuff. So your standard competencies for medical terminology is going to make you able to use the foundational anatomic and medical terms and also abbreviations in written and oral communication with colleagues and also other healthcare professionals. Medical terminology is used to describe and record every aspect of patient care. This includes the medical history, assessment results, treatments, outcomes. The language of medicine is derived primarily from Greek and Latin terms. If you understand the origin of medical terms, the components, and the guidelines for forming the words, you will be able to identify and use medical terminology correctly and communicate effectively with other healthcare providers. Incorrect medical terminology usage. This could lead to ineffective or even harmful treatment of a patient. It could cause the patient to lose trust in your ability to care appropriately for him or her. Comprehension of key terms, acronyms, symbols, and abbreviations is important. The breakdown of each word into its separate components, the prefix, the suffix, and the root. You learn the established and accepted medical terms and abbreviations for your local area. No common slang words used in the MAS. Download a medical terminology app or carry a field guide or documentation handbook to look up quickly and easily any unfamiliar terms. Alright, most medical terms have Greek or Latin origins. Medical terms that refer to disease are derived from Greek words, and words that refer to anatomic structures are usually derived from Latin words. That I think is pretty important, and I would remember that. So I'm going to use my little writing tool here just because I haven't got to, and it's going to be fun. So disease, medical abbreviation for disease is DZ. It's going to be your Greek, and Latin words are anatomic structures. That's going to be fun to write. I really need to invest in a mouse here, guys. But we're going to do this anyway. Because I'm enjoying this. I don't know if you're enjoying this, but I am enjoying this. Anatomic structures. So, Greek words relatable to diseases, Latin words relatable to anatomic structures. I've also got this cool little laser pointer here that I'm going to be playing with. So, Greek disease, Latin anatomic structures. I would remember that. And that sounds like a fun bonus question. Eponyms, that's a fun word too. It is the name of a disease, device, procedure, or drug based on the person who invented, discovered, or first described it. So it gives you examples here as McBurney point, Foley catheter. This often includes the name of the physician or surgeon who either discovered, described, developed, identified, or invented a particular anatomic part or region, physiologic function or process, disease or syndrome, diagnostic or surgical procedure, treatment protocol, or instrument. It sometimes appears in possessive form, such as Hodgkin's disease, and sometimes not, Hodgkin disease. So the difference between possessive and non-possessive is going to be the apostrophe S. So that makes it possessive. Where's my pointer? There it is. No. Okay, no. There it is. That makes it possessive. Okay. So examples: McBurney point, Foley catheter, Babinski reflex, Crohn disease, cesarean section, Levine sign, Apgar score. Um, those are pretty neat. So, I would be interested in who can tell me what a Babinski reflex is. So let's see, just to see if you're actually listening to this and paying attention, let me know what a Babinski reflex is. We're going to write it here. This is one of my favorite reflexes. So I foresee myself having a lot of fun with this, these little tools. And I also think that it will be neat to go back at the end of all this and see how my handwriting's improved with it. So, okay, moving on. Alright, homonyms are pairs of words that are pronounced almost the same way but are spelled differently and have different meanings. Example would be Elium and Elium, Ileum and Ilium. Antonyms are pairs of word roots, prefixes, or suffixes that have the opposite meaning of another word. Example is EU, which means good. So let me put these on here. EU means good. Mal, this is something you've heard a few times this week. Mal means bad. Makes sense. Malpractice, malfeasance. Ad, AD, is toward. And ab, AB, means away. Synonyms, these are pairs of words, roots, prefixes, or suffixes that have the same or almost the same meaning. Examples would be the prefix of a pneumonologist and a pulmonologist. They both mean lung. So pneumo and pulmo both are associated with lungs. The components of a medical term. These are distinct parts of the medical terms that perform a specific function. A prefix is the portion that appears before the root word. A suffix is the portion that appears after the word root. A word root is the foundation of the term. A combining vowel is a vowel that links one or more word roots to another component of a term. And the way in which the parts of a word are combined determine its meaning. So the prefix, this appears at the beginning of the word. It generally describes the location or intensity of the word root that follows. It also is used to specify time or to indicate uncountable quantities. It changes the meaning of the medical term as a whole by describing the what, how, why, or when of the root. So some examples of this would be sub. Sub means below. Cutaneous means skin. So the word subcutaneous would mean below the skin. Hypo, that means low. Hypovolemia would be low blood volume. Hypoglycemia would be low blood sugar. So just from that, you've got hypovolemia, again, low blood volume. Hypoglycemia is low blood sugar. So what do you think? Which part of that word do you think would represent blood? I would like an answer to that. Numerical prefix. This is used to indicate the number of sides, limbs, or sensory organs affected. Examples is octo, that means 8. Um, an octogenarian would mean a person between the ages of 80 and 89 years of age. That's pretty neat. A suffix is a component added to the end of the word root. This changes or adds to the word's meaning or provides further definition. In medical terminology, a suffix usually specifies a procedure, condition, disease, or part of speech. Example would be ASE, ACE. It indicates an enzyme. Lip, LIP, means fat, so lipase is an enzyme that digests fat. The word roots. These establish the basic meaning of the word and frequently indicate a body part. Prefixes are added to the beginning of a word root and suffixes are added to the end of a word root. For colors, there are several word roots that are used to describe color. Cyano would be blue. Leuco is white. Erythro is red. Cero, like cirrhosis, would be yellow or orange. Melano would be black. Polio is gray. ALB, alb is white, like albino. And chloro is green. Um, those I would definitely know. Combining vowels and also combining forms. So when you combine vowels, this facilitates the formation of a new and more complex term. To make pronunciation easier, sometimes it is necessary to change the last letter or the last few letters of a word root or prefix when a suffix is added. I'm all about making words easier to pronounce. I struggle with some of these. They should have used this for rural. A combining form is a word root, prefix or suffix with a combining vowel. Example, osteopathic. The first word root is osteon, which is Greek for bone. The N is dropped and the combining vowel O is added to create the combining form osteo. Adding the O facilitates the addition of a second combining form, pathy, from the word root patho, meaning disease. Guidelines for adding combining vowels to word roots. They use a combining vowel before a suffix that begins with a consonant. Use a combining vowel to join other word roots, such as gastroenteritis. Do not use a combining vowel before a suffix that begins with a vowel. Compound words. Compound words are terms that contain more than one word root. Each word root retains its basic meaning. Examples would be electrocardiogram or thermometer. Plural endings. Rules to change a medical term from singular to plural. In most cases, add an S to the singular word. For some medical terms, singular words ending in A are changed to AE. Example would be vertebrae. Vertebra becomes vertebrae. Singular words ending in IS are changed to ES. Example would be diagnosis becomes diagnoses. Singular words ending in EX or IX is changed to ICES. Example would be apex becomes apices. Singular words ending in ON or UM change to A. Example would be ganglion becomes ganglia. Singular words ending in US change to I. Example would be bronchus becomes bronchi. All right, your topographic anatomy. This is stuff that you should remember from EMT. This is superficial visible features on the surface of a body that serve as guides or landmarks. Taken together, these features make up the body's topography. The anatomic position is a person standing facing you, arms at their sides, with the palms of the hands facing forward so the thumbs are away from the body. This is used to describe the topography accurately. You have anatomic planes and axes of the body. An anatomic plane, which you see here, the green and the blue and the pink. These are imaginary flat surfaces dividing the body horizontally and vertically into sections. So, get my pointer. You have the frontal or coronal plane. This divides the body vertically from ear to ear into front or ventral and back dorsal portions. So we're talking about this blue rectangle here. This divides the body ear to ear into front, which is ventral, or back, which is dorsal sections. Okay. Then you have the transverse or axial plane. That's going to be this green rectangle right here. This divides the body horizontally at the waist. Your sagittal or lateral plane, that is going to be this pink one here. It divides the body vertically from front to back. So this is actually going to be a mid-sagittal because it's dividing right down the middle. Now these planes can move up and down, front and back, side to side. So this is going to be called just a sagittal plane if it's, let's say, more so over here on this shoulder or over here on this shoulder. It's still dividing the body from front to back. It's dividing it into sides. However, when it does go straight down the middle, it is a mid-sagittal plane. Otherwise, it's just a sagittal plane. An axis is an imaginary line that divides the body equally and creates a point of rotation. So this, let's just say that you've got this pole sticking down here through this person that they're just going to turn on. Also notice these here, cranial and caudal. If you can guess, what does that mean? So that goes along with your transverse or your axial plane, this green one here, that divides the body at the waist into top and bottom halves. So above this is going to be the cranial portion, and below this is going to be the caudal portion. So you have different axes. Each one correlates with a plane. So you have your antero-posterior axis. So here, that is going to go perpendicular to the coronal plane. Okay, so, and I know that this is it all kind of squished together and runs together, bear with me. So your coronal plane, which is this blue one here. Your antero-posterior axis goes along with that plane. Your longitudinal axis, which is pointing here, longitudinal axis, is perpendicular to the transverse plane. So here, we're talking about this axis, goes with this plane. Your horizontal axis is perpendicular to a sagittal plane. It is also called mediolateral axis. So here it goes with your sagittal plane. All right. A cross section is taken by slicing across an object perpendicular to its long axis. A longitudinal axis is a view of an object cut along its long axis. All right. FYIs. Um, Specific areas of the body. Many body areas have specific names. Advanced EMTs rely on anatomic planes, body surfaces, and imaginary lines to describe the location of the injury. Example would be sternocleidomastoid muscle, and this is in the neck, and it's a combination of the sternocleido and mastoid, which refers to the sternum, clavicle, and mastoid process, respectively. Body cavities. Get my laser again. All right, so you have the dorsal cavities. These are posterior and include the cranial cavity and the spinal cavity. So here you have the cranial cavity, and then your spinal cavity is going to run the length of the spinal cord here. Okay. Ventral cavities include all of these. They are anterior, which is at the front of the body, and it includes the thoracic cavity. Inside the thoracic cavity, you're going to have the mediastinum here, and that's going to be under your sternum. You're going to have pleural cavity, which is going to be your lungs, and your pericardial cavity, which is the heart. All right, and also a ventral body cavity is going to be the abdominopelvic cavity. So, what does that breaking down? Abdomen, O, pelvic. Remember how we threw that O in there to combine two things? So, abdomen and pelvic cavities are combined in the abdominopelvic. And of course, that is going to contain the abdominal cavity, where all of your most of your organs are located, and your pelvic cavity down here. Your diaphragm, you should know this, is the muscle that separates the thoracic and the abdominal pelvic cavity. Directional terms. All right. These describe relative positions of body parts as well as imaginary anatomic divisions. It occurs in pairs, superior and inferior. So superior is nearer to the head, so it's going up. Superior is the portion above or closest to the head from a specific reference point. Inferior is away from the head. It's going down here. It's the body part closest to the feet. So you're going to use these directional terms if you are trying to describe where an injury is on a person's body. So let's say that he has got a, let's say that he's got a hematoma right here, right above his eyebrow. So you're going to try to describe the location of this hematoma. The closest thing it's to is his eyebrow. So let's say it's sitting right above his eyebrow. So if it, using your directional terms, okay, his eyebrow's here, the hematoma's above it here. So you are going to say in which direction it is this hematoma to the eyebrow. It's going up. That is superior. So you would say patient has a hematoma superior to his left eyebrow. Does that make sense? If it was below the eyebrow, let's say it's right by the eyelid, below his eyebrow, you could say that it is inferior to his eyebrow. Okay. Lateral and medial. These are parts of the body that lie farther from the midline. Those are lateral. Parts of the body that lie closer to the midline are medial. So you are going to look at this in this yellow arrow that's splitting the body. That is the midline of the patient. That is your medial line, okay? So medial is in the middle, okay? Anything that lies farther away from this midline is going to be called lateral. So things that lie closer to the middle, like closer to this line, are medial. Good example for these would be like your wrist, your ankles. So let's say that he fell and he broke his foot. We're looking at right here, okay, this ankle. So let's say that he fell and he has got a large swollen area here, okay, on the inside of his ankle. This is going to be closer to your yellow line. It's going to be closer to your medial point. So this is the medial ankle. If it was on the outside of the foot over here, that would be the lateral ankle. Okay, makes sense? Let's say he's got a stab wound in his outside of his thigh here. That would be on the lateral part of the thigh. All right, so then you have proximal and distal. Proximal describes structures that are closer to the body. Distal indicates structures that are farther from the trunk. So let's look right here, proximal and distal. So let's say that he's got a laceration. So let's put his laceration here. Okay, he's got a laceration there. All right, so there's different ways you can describe this. Yes, you can tell somebody, oh, they've got a laceration on their arm, but you can describe it using directional terms to tell them almost exactly where it is. So remember, proximal is going towards the body, okay? Distal is going away from the body. So you could say that this laceration is on his distal forearm. Okay, it's on the part of the forearm that's farthest away from the body. You could say that this laceration is on the lateral side of his forearm. You could say that he has a laceration proximal to his thumb, because here's his thumb, and it's the laceration is closer to the body than what the thumb is, so it's proximal to the thumb. So there are so many ways that you can use these directional terms to paint a picture, to write a story, to let your reader, your audience, whoever it is, whether it's dispatch doing the QA, or it's billing, or it's the nurse that took your report, or the doctor, you can tell them exactly where these injuries are. Besides just saying, oh, he's got a swollen ankle. Oh, he's got a laceration on his arm. Oh, he's got a hematoma on his head. These are very, very important terms as far as taking your patient and telling their story, turning your narrative into a actual story and painting a picture. Also, you have superficial and deep. Superficial is closer to or on the surface of the skin. Deep would be further inside the body and away from the skin. Anterior and posterior. Anterior refers to the belly side of the body, so that's the front side. Anything on the front side of the body is anterior. This is also called the ventral surface. Posterior refers to the spinal side of the body, and it also includes the back of the hand. This is also called dorsal. So if you're having trouble remembering these things, I know all of you are as crazy about Shark Week as I am. So dorsal fins, the fins of fish, dorsal fins, where they at? They're on their back. Okay, whether it's a fish or a human, the back side of that body, that is the dorsal surface. Palmar and plantar. The front region of the hand is referred to as the palm. That is the palmar surface. The bottom of the foot is referred to as plantar. So palm, palmar, the bottom of the foot, the sole, that is plantar. And that's where you get plantar warts, and those are gross. And an apex, 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 that is the tip of a structure. Okay. So remember these directions. Start using them, learn them, commit them to memory. Take a magic marker and put an X somewhere on your body and use these directional terms to describe in different ways where these are located on your body. Remember that they come in pairs. So you have superior and inferior, lateral and medial, proximal and distal, superficial and deep, anterior and posterior, or ventral and dorsal, palmar and plantar, and again, apex is the tip of a structure. And here are common directional terms. This is going to be table 5-9 in your book. Right and left, top and bottom, middle and side, closest and furthest, in and out, front and back. So this is some of the things that we just went over. Now remember, and these are the common terms for your directional terms. I'm going to come back to this one here. So top and bottom is superior, inferior. Remember, it's closest to the head, closest to the feet. Middle and side are medial and lateral, closest to the midline, farthest from the midline. Closest and farthest, proximal and distal. This is closest to the point of attachment or farthest from the point of attachment. In and out would be superficial and deep, closest to the surface of the skin or farther inside the body. Front and back is anterior, ventral, posterior, dorsal. This is the front of the body and the back of the body. Now, right and left. Remember that when we are talking about right and left, we are talking about the patient's right and the patient's left. That is not going to always be your directional right and left, depending on your how you're standing and facing the patient. Okay. Movement and positional terms. Range of motion is the full distance that a joint can be moved. So flexion is moving the distal point of an extremity towards the trunk. That's right here. You are flexing those muscles, okay? When you pull the distal point, which is the furthest away, that would be the fist here, towards the trunk, that is flexing, okay? Extension is return of a body part from a flexed position to the anatomic position. In the anatomic position, all extremities are in extension. So when you stretch it out, you're extending it. That's extension. Abduction of an extremity moves it away from the midline. Okay, so when your arm's here and you lift it to this point, that is abduction. Adduction moves the extremity towards the midline, so you drop it back down here, and that is adduction. An easy way to remember this, when you pull it away from the body, abduction, if you think about an actual abduction, like and it's not this word, but when someone is abducted and they are kidnapped and they are taken away, okay, you are taking it away, all right, abduction. When you bring it back to the body and you're bringing it close to the core, adduction. You are adding it to your core. You're putting it back. You are adding it. So that is just a simple little way to remember those things. So this figure shows the positions of the neck and a patient found in a supine position. Remember, supine is laying flat. This first one here is a neutral position. I try to write in cursive. It's not working, but hey, we'll go with it. Okay, neutral position. And the next one, you have flexed. What did we say about flexing? When you bring the distal point, so here, what more towards the body. So here you've got the distal point is brought up. You're patting it here, so you're flexing it towards the body. Okay, and here you have extended. I've learned that I need to work on my handwriting. I think this would be so much easier with a mouse, but I did not get up to get the mouse. So extended. Extension is when you take the distal portion and push it back away from the body. So here the head's back as far as it can go. Notice the difference. You might say, well, okay, the head's back, but what's the difference between neutral and extended? Neutral, notice here that it's kind of, you've got a line. Okay, you've just got this flat line here. Notice that the chin is kind of just straight up right there. Okay. That's a neutral resting position. When the head is extended, such as like when you do a head tilt chin lift, notice the angle of the chin here. Okay. It's more leaned back. And notice this arch here in the neck from the head being tilted. So that is an extension because the head is going back. All right, flexed because the head is coming forward. All right, and neutral because you have the spinal alignment as much as you can here, right there. Hyper indicates a mechanism of injury or an excessive movement. Hyperflexion refers to a body part that was flexed beyond its normal range of motion. Hyperextension refers to extension of a body part beyond its normal range of motion. Turning palms toward the sky or upward constitutes supination of the forearm, and turning the palms downward towards the ground pronates the forearm. You can relate that to when you have your patient, you go and stand and they're laying on the ground. If they're on their back, they're supine. If they're face down, then they are prone. Internal rotation means turning the anterior portion of an extremity towards the midline, and external rotation means turning an extremity away from the midline. Other directional terms. You should be very familiar, especially with these on this side. You should already be using these. Bilateral is a body part or condition that appears on both sides of the midline. Examples, you have bilateral ears, bilateral eyes, bilateral hands, bilateral feet. Unilateral is structures that appear on only one side of the body. Examples would be spleen is on the left side of the body, liver is on the right side of the body. Ipsilateral refers to the same side of the body, and contralateral refers to the opposite side of the body. Okay? The abdominal cavity, y'all, this is something like this is again everything that you should remember from EMT. The abdominal cavity is divided into 4 equal quadrants. You have the right upper quadrant. This is going to contain the liver and the gallbladder. The left upper quadrant also contains the costal arch, the spleen, and the stomach. Part of the umbilicus. The umbilicus is going to be right here. It's going to kind of be your cross point right there. Left lower quadrant is the small intestines, the colon, the inguinal ligament, if you've ever heard of anybody having an inguinal hernia, the rectum, the pubis symphysis. Right lower quadrant is the cecum and the appendix. Now, of course, you're going to have parts of these, like here's the transverse colon. So even though it says colon here, don't let that throw you off that, oh, the colon's in the left lower quadrant. This whole thing here is the colon. Okay, so here you have your appendix, your cecum, then you have your ascending colon. It's going up. Your transverse colon is coming across. Your descending colon is coming down. And then it leads to your rectum here. So parts of these are your small intestines, all the little squigglies, all of this is your small intestines. So your small intestines and your colon are located in all 4 quadrants. So don't let these little lines pointing here throw you off. Just because it says umbilicus here in the left lower quadrant side doesn't mean that your belly button is in your left lower quadrant. It's your cross point right here. So your abbreviations here are UQ, right upper quadrant, LUQ, left upper quadrant, or LQ, right lower quadrant, and LLQ, left lower quadrant. Over here, it breaks it down even further. from a 4-point grid to a 9-point grid. So this is going to break it down into different regions. So make sure that you familiarize yourself with these. I would not be surprised if I had to label at least the quadrants and the regions and to identify structures in each of those quadrants. All right, position of the patient. Prefixes indicating position, direction, and location. These are specialized prefixes that specify position, direction, or location, describe the movement of the body or something within it, indicate the location of an organ, foreign body, or mass, or refer to the direction of radiation or ultrasound waves. So position of the patient. Specific terms describe the way the patient was found or the position they were found in when on scene. Prone is laying face down, which is here. Remember when we just talked about the palms, supination and pronation? So this is a prone patient. They are laying face down. All right, supine is with your patient laying face up. They are on their back. Fowlers would be sitting straight up with knees either bent or straight, and semi-fowlers would be sitting with the back at a 45-degree angle. This is most of the time how your patient is transported, either Fowler's or a semi-Fowler's position. That's what this means. So this position was named by some of Blake's kinfolk, Fowler's position. And recovery position. The patient is laying on the left side with head resting on the bottom arm and the top knee is bent. This is also referred to as the left lateral recumbent position. Okay, left lateral recumbent position. Now, obviously, and this is recovery. This is the position that you are supposed to put your patients in, let's say after they've been unresponsive or they've had a seizure and things like that, recovery position. So obviously if they were laying on their right side, it would be a right lateral recumbent position. So abbreviations, acronyms, and symbols. Medical abbreviations, acronyms, and symbols enable faster communication. Do not trade speed for accuracy in patient care. Use only commonly understood acronyms and other abbreviations. Don't make up your own stuff, y'all. All acronyms are abbreviations, but not all abbreviations are acronyms. An abbreviation is pronounced with each letter separately. Example, EMT. An acronym forms a word. Example is Urban Search and Rescue, or USAR, which is pronounced USAR. An abbreviation is still considered an acronym if it is pronounced as a word. Example is Health Insurance Portability and Accountability Act. What do you think that stands for? That is HIPAA. So although people want to say or they want to write HIPAA like this, HIPAA, P, P, A. That is how it's pronounced, with two P's. HIPAA. That is wrong. Okay. So it stands for health, insurance, portability, and accountability act. Fun fact. All right. Medical abbreviations. These take the place of words they represent to shorten patient care notes. They can be very useful for documentation, but must be consistent with those approved for use in your EMS system. Again, don't make up your own stuff. Error-prone abbreviations. The Joint Commission and the Institute for Safe Medication Practices, or the ISMP, have each published a do not use list of abbreviations to prevent serious errors. Example, HS on a prescription can mean hour of sleep or half strength. Avoid using trailing zeros after a decimal point, but include leading zeros prior to the decimal. So don't use 5.0 milligrams. This could be misread as 50, but you should use 0.5 milligrams, not 0.5 milligrams, because that could be read as 5 milligrams. Symbols, sometimes used as a shortcut in documentation and other communication. Only use symbols that are widely understood and accepted. Example is the lesser than and greater than could be mistaken for a 7 or an L. The Joint Commission requires every hospital to issue a list of approved abbreviations. Fun fact, this symbol means change. So if you read my narratives, dispatch, when you see this symbol at the bottom of the PCR or whatever, when we were doing paperwork, it's a patient condition, and I would write this, an S with a line over it, and a triangle. This means without change. So, fun fact. This symbol, C with a line over it, means with. So this is with, this is without. Oh, let me get my laser pointer. With, without. Didn't give me my pointer. I'm double clicking it. There we go. Again, with and without change. Those are some of my fun ones. It actually is going to give us abbreviations, acronyms, and symbols. So table 511 shows commonly used symbols. Of course, you have your degree sign. So the number 1 in a degree sign, this means primary, first, or first degree. The 2 with the degree sign is secondary or second degree. I use this a lot when I'm describing my bedbound reasons or PUTS reasons. They have AMS secondary to dementia, AMS secondary to CVA, weakness secondary to CVA. Arrow up is increased, arrow down is decreased. The A is alpha. Your funky little B there is a beta. Your pound sign is number or pounds. 0 with a line through it is null or none. So then you got your little squiggle lines. Those mean approximately. A capital N is normal. X2 is times 2. A slash is per. The plus over the minus is plus or minus, give or take. Equal sign with a slash through it is not equal. Then you've got your greater than, your less than symbols, greater than or equal to, less than or equal to. Remember the alligator mouth always eats the biggest thing. So a question mark means it's questionable or possible. There's my little triangle. That means change. Minus sign is negative, and then your signs, of course, for male and female. Be familiar with terminology related to medications and medication administration, such as common prefixes, common metric conversions, and common medical abbreviations. And table 512 is going to show you prefixes commonly used in medication administration. Micro, MC, milli is a M, the centi is a C, kilo is K, mega is a capital M, and then their values, okay? So micro is 1/1,000,000th, milli is 1/1000th, centi is 10, kilo is 1000, and mega is 1,000,000. And then table 513 is metric conversions used in drug calculations. So by weight, you have the kilogram, which is 1,000 grams or 2.2 pounds. 1 gram, which is 1,000 milligrams. 1 milligram is 1,000 micrograms. Don't be surprised if registry doesn't ask you for conversions, and it's not necessarily going to be as plain as this. They may ask you how many micrograms are in a gram. So you have to convert from micrograms to milligrams, milligrams to grams. Volume, so 1 liter is 1,000 milliliters. If you convert these to memory, the milli, micros, millis, centis, kilos, megas, it'll help you in your conversions over here. Temperature 37 degrees Celsius and 98.6 degrees Fahrenheit. Okay. 1 centimeter is 0.39 inches or 10 millimeters, and 100 centimeters is 1 meter.